So anyway, I have a few minutes here and the privilege of talking to Dr. Jeff Wright, and you're the director of the North Utah Health Center?
Utah Valley Health Clinic.
Utah Valley Health
Provo,
Clinic.
Utah.
And just tell me what you do there.
We do a lot of things. We take people who are chronically ill who tend to not get better with medical care, normal medical care, and we turn them around.
What's your personal role there?
I'm the medical director.
Okay.
And I'm kind of the head cheese.
The head cheese, okay.
I'm the guy who's in charge, who's overseeing everything, making sure that everything's done properly.
Okay, good. Now, I know Ann Hansen works there quite a bit, doing contract work with a lot of your patients.
Mm-hmm.
And what I wonder is if you could just tell us some of the results. First of all, some of the kinds of patients that you've referred to her that she's treated there, and what are some of the results that you've seen specifically from her microcurrent treatments?
First person that comes to mind is one gal who has had MS for 8 years, and she has primary progressive multiple sclerosis, which isn't supposed to get better. And last time we referred her back to the neurologist to have her review her and take a look at it, and she said, well, I don't know whether you have primary progressive or whether you had primary progressive multiple sclerosis, but you don't have it now. So actually the lesions were reversed, and a major piece of how that happened was for what Ann does, the microcurrent.
Wow.
It's pretty amazing, pretty impressive.
That is amazing, and that's something that we're just trying to get this information out to more people. What are some of the other conditions you've seen? And do you need to jog a memory, or you probably remember your patients?
I remember them quite.
Okay.
Quite
Great.
well.
Okay. Good.
I send all my hard cases to Ann.
Okay.
Actually, I don't get any easy cases, so I shouldn't say that. Everybody I see is a hard case for the most part. I've sent somebody who had ankylosing spondylitis,
okay,
and he's noticed a difference in the pain level that he's had, and he was a man who was on 4 Lortab every night to sleep. My daughter, who has some, we don't like to call it asthma because we don't want to let her know that she has asthma, but that's made significant improvements in her ability to breathe. We have a gal who we've worked with depression and anxiety and bipolar disorder, and we have a gal who has bipolar, and after a number of treatments with this technology, she has she's still cycling, so she's still going up and down. Right. But it used to be that her depressive episodes would last 3 to 4 weeks. Her last depressive episode lasted for 1 day.
You told me about that. That was amazing.
So it's really impressive. I went and I put myself through everything. I do everything that I ask my staff and my patients to do, and I put myself through it, and I had some wounds that healed more quickly, and my energy has improved. So it's been very amazing. And in fact, 2 nights ago I had this technology. I was feeling a cold, and I got worked on for 2 minutes by you,
right,
and I didn't feel anything after the fact, but about 3 hours later my cold completely lifted, my appetite returned, I slept great that night, woke up in the morning totally fine. So very impressive, very impressive.
How would you see this fitting into some of the other modalities at your clinic? Like, in other words, do you see microcurrent as a treatment by itself, or more something that enhances other things you're doing? I mean, what's your view of it, since you're the overlord of everything going on there?
I don't think that any therapy exists in a vacuum. I think that every therapy is complemented by other therapies. Now, we have a lot of other therapies in the office. We do a lot of nutritional medicine in the form of injections, as well as IV therapy, as well as oral nutritional medicine. We also do acupuncture, and we do hydrotherapy. We do allergy testing and screening, and desensitization to allergies. And so all of these things fit together because all modalities work well together, and the more things that people can do, the faster they can heal. Not everybody needs to do everything, and we try to just find the most important things for the individual so that they can heal. One of those pieces, and this is why it's so important, is the microcurrent. The microcurrent really gears in and focuses everything else and makes everything else work better, and actually helps people to heal more quickly.
You know, that's exactly what my observation has been, is that I do a lot of microcurrent by itself, but I've found that adding it to other modalities, it seems to amplify the beneficial effect and just bring in the results more quickly and more lastingly. So
I find that we get a synergistic effect.
Right.
When things work together, people get faster results, and they heal more quickly.